Welcome to Behavioral Health Today, a podcast brought to you by the Triad Network. This podcast is designed to share trending topics occurring within the world and our communities and bring them a behavioral and mental health perspective.
Welcome to Behavioral Health Today. I'm your host, Sharlee Dixon, and today I'm joined by Dr. Katelyn Lehman. Katelyn is a pioneering psychologist and the founder of Quantum Clinic, a Los Angeles-based wellness center dedicated to heart-brain coherence and nervous system healing through sympathetic resonance. Her innovative approach to mental health has been featured in Goop, the LA Times, NBC, and Beverly Hills Times, where she's been recognized for building a movement of radical reconnection with nature, our bodies, intuition, and one another. By blending science and spirituality, she's reshaping the landscape of mental wellness, offering transformative healing experiences. Today, we'll explore Katelyn's journey from political and cultural psychology to founding Quantum Clinic, discussing how its floatation therapy, biofeedback, and coherence training promote deep healing, preventative care, and the integration of psychedelic experiences, while also examining how this innovative model is pushing the boundaries of traditional mental health care. Well, welcome to the show today, Katelyn. Thank you so much for joining us.
It's my pleasure. Thanks for having me, Sharlee.
Absolutely. So can you start by sharing a bit about your background in political and cultural psychology and how that led you to create Quantum Clinic?
Sure. So I actually have a PhD in clinical psychology with an emphasis in multicultural and community psych. So I went through the traditional kind of APA accredited doctoral training program here in Southern California, worked in a variety of different settings, community mental health, working with chronic and severe mental illness, addictions, rehabilitation, substance abuse settings, and then also did about a year and a half in a forensic setting. So with folks exiting the incarceration system. And from there, I segued into kind of medical legal casework where I was doing evaluations for both on the, claims side, but also working with immigrants seeking asylum and things like that. And then back in the COVID times, after the birth of my son in 2019, I started asking myself, okay, I'd taken some time off for maternity leave, and I'd taken a generous maternity leave to really focus on those early months and years. And I started asking myself, okay, what are the ways that I could contribute to my community as I re-enter the workforce? And through that process of discovery and just kind of reflecting on, all of the experiences I'd had and what was missing here locally, I developed kind of this integrative model of preventative mental health care. And we call it Quantum Clinic. And it's here on the beautiful Los Angeles River. And I'm happy to talk more about that.
Yes. Can you share more about what you guys do at Quantum Clinic? Kind of give us an overview of who you see there and what types of services you provide.
Yeah, absolutely. So the long and the short of it is we combined kind of three existing evidence-based interventions into one comprehensive experience for clients, right? Like as you know, there's a real difference between talking about something and embodied experience of it, right?
Absolutely.
So we all know that meditation and mind-body practices are good for us, but until we really experience or have a place to really feel what that's like for us, it can kind of remain just this abstract idea, right? You know that the research backs it up, that people who meditate regularly have greater gray matter density between the prefrontal cortex and the amygdala, and greater access to creativity and clearer thinking, greater concentration, all of those things. But our mental health systems are not necessarily set up to empower people with those experiences in a systematic or regular way. So we combined biofeedback training in meditation using little heart sensors that clip onto the ear that measures heart rate variability. And we do like a pre-float rituals where or a guided meditation that includes a body scan, developing some kind of interoceptive awareness of bodily sensations, breathing in relationship and connection to our heart. And there's lots of research that comes out of the HeartMath Institute on what are the benefits of that or why we would want to do it. So that sort of training or entrainment in heart-brain coherence is the first part, the first pillar. The second pillar is REST. Now, that's an acronym that stands for Reduced Environmental Stimulus Therapy, or floatation rest, right? A lot of people have seen or heard about float tank clinics, et cetera, et cetera. What is it? Well, it was actually established back in the 1950s by a guy named Dr. John Lilly, who was a neurologist who happened to be psychoanalytically trained as well. And he was working, I believe, for the National Institute of Mental Health at the time. And so he thought, like what would happen, right? If we kind of create an environment where you're reduced of all of the external stimuli, would you then have an experience internally, right? And of course, over the years, been, 50, 60, I guess now maybe even 70 years that this concept has been around. It's a lot more user-friendly than those original designs. It's very elegant space. A lot of people are a little bit trepidatious around what is this experience going to be like for me?
Yes.
But really, it's one way to think about it is it's a supportive environment to have an encounter with yourself, right? So if you're somebody who has a really chaotic inner environment, it's going to mirror that for you. And if you're somebody who has a really harmonious or peaceful or, kind of calmer disposition, the experience will mirror that for you as well. And, but it also supports people who come in feeling relatively dysregulated in accessing deeper states of relaxation, serenity, reduced anxiety. It reduces cortisol and blood pressure levels and all that good stuff, right? So in a relatively short period of time, the effect size is, in a meta study, it looked at the effect size of this at 0.73, which is the top 25% of effect sizes. So it's a really effective tool for reducing stress, reducing anxiety, and if done regularly, supporting mood regulation. Now, since I know you work in medical settings, I'll share that often, especially when we go through difficult, medical procedures over long periods of time, because, whatever the case, whatever the diagnosis may be, you want to think about Quantum Clinic as the type of space that can support healing outcomes, right? Maybe you're not coming to us for dialysis, but you're coming to us for this deep, restorative, restful experience that helps the body-mind kick in those innate and natural repair and restore functions, right? So that happens over the course of about 1 hour in the tank. You can be a little bit less depending on how long we set it for. And then after that, we have a lounge for what we call our expressive arts integration lounge. And there's tons and tons of literature to support how the expressive arts can support healing outcomes when dealing with a variety of issues, right? So a lot of hospitals these days will have expressive arts therapists come into the hospital and do stuff like that, right? Have it centrally, integrally up as a part of our core, therapeutic process or experience that we walk clients through. So, from start to finish, our clients come in and they're with us for maybe about an hour and a half. Again, it includes those three components: the guided meditation and heart-brain coherence with the floatation rest. We do place some sounds in there, and then the expressive arts therapy.
Wow. So it seems like you've done an excellent job. Even looking through your website, it seems like it is more geared towards a spa-like feeling versus something that is more clinical. So why is that important, or why was that important in how you designated that space? And I'm sure.
Yeah. No, I love that you asked that question. It's so important. The built environment, right? The environments we spend time in actually really affects how we feel, right? And certainly this is not a knock on any individual people working in hospital systems or, hospital systems themselves, but there's more healing spaces, in general. They're pretty austere. They're pretty,
have to be
the
sterile.
word clinical, right, kind of evokes this sterile environment, right? And of course, we take hygiene very seriously at Quantum Clinic. It's, the filtration and hygienics of our facility is top notch, but we wanted it to feel like a warm embrace when you first walk in. And that really does contribute to the overall experience that people have when they come to us.
Got it. Got it. I mean, when I looked at the website, I instantly was like, wow, I wish that Quantum Clinic was closer to me, but I'm on the other side of the country. So
Maybe one day.
maybe one day I'll have to look you guys up when I'm on that side of the country. But I'm curious. I've seen, and you mentioned it here as well, the lots of the floatation spas or the rest spas that feature a similar situation, just that piece of what you do. Can you
Sure.
discuss the differences between what we may see at like a purely spa situation for floatation versus what you do in your quantum clinic?
Yeah, so I would say the primary differentiator is our team of licensed clinicians, right? So we're a team of mental health professionals who this is our practice right now.
Got you.
A lot of these facilities, there's been an uptick in them around the country
Mhm.
because it's sort of popular in people's minds, right? It's
Right.
as a novelty, but they're mostly run by enthusiasts, which is not to minimize the experience, but sometimes these spaces can be much more transactional, right? So,
Right.
okay, you pay your money, here you go, here's your room, you're off, right?
Yeah.
And
Yeah.
for people who are relatively secure inside of themselves, people who look at it as a transactional service may still experience the benefit of, reduced blood pressure and reduced cortisol by just, the fact that they're in a body of highly salinated water for a period of time. Like that is true. But what differentiates our work from some of those other spaces is that, we really think of this as a comprehensive and integrative model of preventative care. We're also combining that psychoeducational piece on the beginning and supporting people with a post-float integration space to really deepen those insights that come through and support them and then, taking that into their lives.
So as a patient to your quantum clinic, can you walk us through what that experience feels like? What types of things should patients expect?
Yeah, absolutely. So when a client comes to us for the first time, we do what would be called a biopsychosocial. So ours is a self-report that captures demographic information, the reason for visit, family and medical history, an assessment of strengths, abilities, needs, and expectations. Those are multiple choice questions. Then we follow that up with a mental health inventory, which is a questionnaire that's got 38 questions. And it helps us get a sense for folks' mental status by way of how they respond to those 38 core questions. Then we have 2 additional screeners that are specific to the trauma-informed side of things. So we're asking the BTQ, or the brief trauma questionnaire, which is 10 yes or no questions, and followed by a trauma symptom inventory, which is 10 questions. But those 2 are optional because we get a lot of clients who are not necessarily seeking services for that reason, but we did feel it was important to at least ask.
Got you. Okay. And do you use those assessment processes or questionnaires to kind of guide the heart brain coherence techniques?
Yeah, so our clinical staff is obviously reviewing those assessments, signing off on those assessments prior to the client's first visit, and then we're sort of we use it to inform our relationship and rapport building with the client.
Got you. Okay. And so speaking more just on flotation therapy, we talked before that I'm very interested in it and actually thought about trying it out myself. And so can you talk a bit about what are some of the most profound experiences that clients have reported after having a session? And does it take, long term, we need to go once a week for a month? Like what does that look like?
Sure. So you can experience immediate benefits after just one session, but the research on this type of intervention show that the impact is cumulative. So it's increased when you go more regularly. It's kind of like, think of it like working out a muscle, right? You want to get really toned abs or strong, biceps, you've got to put in the reps, right?
Yep.
So it's the same concept. You would want to put in the reps. If you're really working to unwind the patterns of toxic and chronic stress, emotional overwhelm, and burden that so many of us carry, right?
Yeah.
Implicitly embedded in our cellular biology, right? Like, and often for generations and generations, those of us in the helping professions, we know that that doesn't happen overnight, right?
No.
So, so it takes time, and your body and your mind will only let go to the degree or the quality or the level that you're willing and ready to receive, right? So there are some folks who do seek out sensory deprivation or floatation therapy for the more kind of psychedelic or mind expanding aspects of it that are possible, but more often than not, people experience it as merely a deeply relaxing process where they can connect to the innate wisdom inside of themselves.
Good. All right. And so earlier you mentioned the heart brain coherence as one of the guiding principles of healing. And it's something that every client begins their sessions with you guys. Can you explain what that is and why it matters for well-being?
Yes, I love that question. It's one of my favorite questions to talk about. So, if we just think about the body, right, the human body, so many of us are walking, talking, thinking heads, right? But if you think about where the heart is located inside of the body, it makes sense that there would be a relationship between the heart and the symphony of the fullest expression of our mind and body, right?
Right. Right.
So heart-brain coherence refers to the synchronized entrainment of heart rate variability, respiration, and blood pressure, right? So this is achieved through the practice of heartfelt, sustained, positive emotions. So think joy, think gratitude, think or feel awe or wonder or reverence, right? These more kind of esoteric, positively oriented, life affirming and life sustaining emotional states. What that does when you're really feeling that in your body and connected to your breath is it generates a more what's called sine-like or wave-like, predictable wave-like pattern in the electromagnetic field resonances of the heart, right? And then that drives what's called vagal afferent traffic. So if you then that information that's generated in the heart is sent upward to the brain, and the brain receives that information and processes it to set in motion a cascading effect of over 5,000 positive neurochemical, neurophysiological, et cetera, changes in the body mind, right? So it's really about beginning to harness our capacity to connect with the wisdom of our heart and these positive affective states to support overall well-being and psychological functioning and resilience. It's associated with all sorts of things like improved cognition, creativity, access to different kind of transcendental states, improved attention, focus, concentration, all of the areas of, cognitive functioning, right? Memory improve as a result of this. And it makes intuitive sense, right? If you're running around stressed in life, and again, many of us are, right? We have an epidemic of stress and depression and anxiety and emotional overwhelm. And it seems at times like there is no end to the chaos. But we do have the capacity when we practice this stuff to shift at least our internal physiology, right? And then that allows us to show up differently in our world and in our relationships and in our communities. So it's good for you, and it's good for everybody else too.
We'll be right back after a word from our sponsor.
Americans are increasingly concerned about mental health, with nearly 9 in 10 voters seeing it as a crisis. Mental Health First Aid provides crucial training to identify, understand, and respond to mental health and substance use challenges. Gain the skills and confidence to offer life-saving assistance. We offer courses for individuals, groups, and organizations of all sizes, including specialized training for veterans, law enforcement, EMS, and educators. Visit mentalhealthfirstaid.org or email hello@mentalhealthfirstaid.org to schedule your training and make a difference in your community.
So as a patient, what does that look like? What does that feel like? Can you kind of talk us through how that practice works, in real time with a patient?
Yeah. So you come in, you're greeted by one of our clinicians. We orient you to the service environment. We come back up to the front and sit on the couch together. There's an intake assessment. So we know a little bit about you. We ask, how things are going. And then we hook up a little biofeedback sensor. It's a little tiny little sensor that clips onto the ear, and that's attached to an application on a tablet, right? That is measuring your heart rate variability over the duration of the meditation. So it's about a 5 to 7, maybe sometimes 10-minute meditation where the clinician is wearing one too. And we're going through a body scan, starting at the top of the head, relaxing the muscles, the jaw, et cetera, moving slowly down the body. And then inviting the client to imaginally, right, using guided imagery, to connect with the energetic center of one's heart and to activate a life-affirming or positive emotional state. So we sometimes encourage them to think of a memory that can help them feel that, or there's lots of different techniques that we can use to support one in connecting to the heart. But you can usually see a shift because we're tracking this on those apps. Okay. And so when someone is in a state of stress, the heart rate variability is much more erratic and irregular, right? And then as they become more coherent, the shape of that information becomes more regular, more patterned, more signed. So you can see it. And, at the end of the meditation, it has a score associated with it. So 1 is good, a 2 is great, a 3 or above is excellent. We get people across the whole spectrum, and it changes moment to moment, day by day, visit by visit. But it's sort of it's from a health sciences perspective, it's a measure of neurocardiac function. So the heart and the brain. That is associated with a great number of positive health outcomes. So we're coaching people into that state, giving them an experience of it, and then encouraging them to continue practicing that while they're in the tanks.
Got you. And so just a question about coherence itself. Is the state of coherence, is that something that a client, after, some time of doing it, being led by a clinician, is that something that can be achieved by oneself?
Okay. 100%. Yeah. Yeah. And we hope for that, right? It's interesting. Some people are really intuitive and natural at it. Like their scores are super high. It's really easy for them to get into that state. And some people, it takes a little bit more practice. So, we don't see that there's anything wrong with it one way or the other. It's just a measure that gives us a baseline and supports with an understanding of, okay, maybe this is an area for me to keep exploring, keep practicing, and improve over time.
Got you. And so you did mention multiple times that people that may benefit the best from this type of work are generally people who are overly stressed, experience stress quite often. Is that the only type of patient or person that could benefit from this type of work, or who else can benefit from this?
Well, so, stress and inflammation are generally understood to attribute for causally about 98% of all disease, right? So, I mean, that's huge, right?
Yeah, it is.
It creates the conditions inside of us that manifest in disease, right? So this is why we think of it as a preventative care measure, right? So anybody can benefit from this, even if you don't consider yourself a highly stressed person. Cognitive stress and physiological stress are also sometimes not correlated in the way that we might think that they are. Like maybe somebody's carrying stress in their body, but they're not aware that they're carrying that stress as much, right? So we like to say every body deserves rest. Like if you have a body, you deserve rest. And from a kind of liberation and decolonial kind of angle of all of this, it's like, yeah, we really all deserve rest. Like,
Absolutely.
and so how can we make it more accessible for more people is how I spend most of my day.
Got you. That's impressive. And I mean, the fact that you just mentioned that statistic, 98% of illnesses, sicknesses come from some form of stress.
Inflammation.
And inflammation that is sitting with me pretty heavily. And we talked before that, most of the people that I work with these days, well, all of them, they're on dialysis, and the leading causes of dialysis are high blood pressure and diabetes. But a lot of that you just mentioned can be lessened with some level of rest
Or
and
coherence
coherence.
practice.
Yes.
Yeah,
That
exactly.
is very interesting to me.
Yeah.
Okay.
There's a feedback mechanism happening within us, right?
Mhm.
So, I mean, and this is sort of the new science of spirituality, the science of interconnectivity, right? It's just that we haven't created a world or a society that really empowers people with these skills and tools at an early age, right? And so people don't grow up thinking about their inner environment
No.
in this way. But there's a real light bulb that goes off in a lot of people's hearts and minds when they really kind of connect the dots with this. And we're really grateful to be contributing to that here.
Awesome. So speaking of other types of illness, things like chronic pain, is that
Yeah.
an area that you guys work with as well?
Yeah, definitely.
Okay.
Chronic pain, I mean, pain, especially women's pain, is so often dismissed
Yes.
by the medical model, right? Because it
Yes.
doesn't
Yeah.
fit into, our conception of the body as a machine, right? Like it's like
Mhm.
inputs and outputs, right? And there's often, though, this can also be a nuanced conversation to have with people who do suffer with chronic pain, but there is often also a psycho-emotional component to chronic pain, that it sort of creates a negative feedback loop where the pain creates more stress, more emotional overwhelm, feeling hopeless and helpless about one's pain, et cetera, et cetera.
Mhm. Mhm.
So an intervention space like this serves as an opportunity to break that cycle, because especially if you are somebody dealing with, like, say, neuromuscular pain or, along the neck, hips, and spine, something like that, floating in this water that has over 1,500 pounds of Epsom salts, right? It alleviates about 95% of the effect of gravity on the body. So
Mhm.
that whole spinal column and all of the nerve fibers and everything that is connected to it can let go, right? In a way that's unique to the environment, right? Because you're sustained in the water.
Yeah.
And, Epsom salts are good for muscle recovery. So it also has the benefit of supporting with the muscles.
Yeah.
So it's kind of, it's unique in terms of its ability to support people who deal with chronic pain. Again, you may experience kind of the immediate relief of being in the float space. And then
Mhm.
some people also report that it helps them, sustain that. We have one client, she's in her 70s. I haven't seen her in a while, but she deals with chronic pain and inflammation. And for her, when she's able to afford it and when she's able to come in and do it, she says it's the only thing that helps. And it really, really supports her. She's taking pain medication for her pain regularly, and she
Right.
can skip one of her doses if she comes in, right? Like she
Wow.
doesn't have to take it. And that's a big deal for people,
Mhm.
That's a big
It
deal for
is.
people who are really struggling.
It really is, because while the pain medication it's helpful, it also is something that you kind of have to carry around with you. It's a chain to you. You have to
Yeah.
have it at all times.
Yeah.
Yep. And so, digging deeper into just the float tank experience, as someone who does not swim very well and cannot float, I would assume, on my back, how do you work with someone that may have challenges with just the enclosed space or just that experience of being fearful of water? What does that
Yeah,
look like for, for a patient experiencing those things?
sure. So the first thing that we always want to do with our clients is reaffirm their safety, right? It's actually not possible to sink or flip over in the tank without exerted effort on the flipping over part, but the sinking you cannot sink. It's chemistry, right? There's 1,500 pounds of salt in the tank in the water. And so when you go in there and you lay down, yes, typically on your back, you will float, right? You will float. So just supporting people in an understanding of that is usually enough to get them over the hump of the fear of drowning, right? The fear is
Yeah.
one of drowning. So we really want to affirm that and support people in understanding that that is the case, right? Then, claustrophobia or the fear of enclosed spaces is a unique issue that we do see a lot, right? A lot of people sort of are anxious about enclosed spaces, fearful about enclosed spaces, but may not meet full diagnostic criteria for
Right.
claustrophobia. So I tried to address that in two ways. One is by choosing a design of a tank that is very spacious, very ample. They're over 6.5 feet in length. The ceiling is almost, 7 feet tall. And the single occupancy one is over 3.5 feet wide. So it's a big
Oh,
space.
okay.
And there's a couple different designs out there on the market. Some of them are what are called pods, where you have to go in and pull the top down.
Hmm. Hmm.
That felt a little too coffin-esque for me. So
Okay.
we went
Okay.
with ones that have a door, right? There's an elegant door that's sort of built into the shower and changing room. When people see it, like with their eyes, and they like look in and all of that stuff, usually the anxiety comes down quite a bit, right? Because they're
Okay.
like, oh, I could do that, right? If you can go into an elevator, you can do this, right? And there are different modifications that we have, including leaving the tank door open, or just going in and seeing how it feels for a little while, and then you can get back out and you can go back in, right? You can
Okay.
go at your own pace. But this is again one of the reasons why having our staff who are so well trained running this operation, right,
Hmm.
is
Hmm.
important, because people do bring their fears and anxieties about that.
Absolutely.
Um,
Absolutely.
the only other thing I'll say about that is that, the gold standard treatment for claustrophobia is what's called exposure with
Exposure.
response prevention,
Mhm.
right? So that is ironically exactly what we do. We coach you in a particular type of breathing and then
Mhm.
expose you to the feared stimulus. So I have worked with somebody who was seriously anxious but really eager to confront that. So she left the tank door open, and then she actually also left the door to the hallway slightly ajar. So,
Okay.
so that she psychologically knew, okay,
I
I'm
can get
actually
out.
not closed in. I've
Mhm.
got all of these openings around me, right? And
Nice.
she was able to rest for the full hour and came out feeling really, really relaxed.
That is amazing. Thank you for that.
My pleasure.
You mentioned, you brought up something that I was curious about as well. Unlike traditional or talk therapies, Quantum Clinic does not seem to operate the use of insurance and the typical CPT or Z codes and diagnoses. So
Yeah.
how do you see the model evolving? How are people like in their 70s able to afford it and working into their budget?
Right. So this is like where I spend most of my time and mental energy right now. I'm
Yeah.
admittedly a step removed from our kind of day-to-day clinical operations because, I'm trying to figure that out.
Yeah.
So we do accept HSA and FSA, so health spending accounts or flex spending accounts, which are, pre-tax incentive programs offered through
Mhm.
some employers. We can accept that, pre-tax money in exchange for services. And we finalized an accreditation process at the beginning of the year. So our organization is now an accredited behavioral health facility. and our model has been accredited by, peers. That's what they do, is accreditation. And so we are beginning to have some conversations with providers and payer networks like Blue Shield and Medicare. It sort of is like, in our field, it's like you have to have a qualifying disease in order for the medical necessity for the equivalent level of care or treatment, right?
Yeah.
So we're trying to position it as a preventative care solution, a value-based solution. And we're looking at CPT codes associated with like health behavior interventions and health behavior assessment. And so, because there is no CPT code for float therapy, it doesn't exist. But that's just part of this stage of the evolution of healthcare systems and behavioral health systems. Like, if we want to think of different ways to help people, we have to kind of find a way.
Right. And first, congratulations on accreditation. I know that is not a simple or quick process. So congratulations for that. And being able to, I guess, expand your mind past what is able to happen now. How do you think Quantum Clinic's expansion could be? Like, where do you see it going? What do you think it would look like? Could you see a virtual option being available? How do you reach more people?
Question. Yeah, so we are going to be launching some online courses, and these are, mindfulness-based cognitive behavioral therapy, foundations of Buddhist psychology, and a course called Awareness in Action. So the idea is to take people from a very kind of narrow-minded ego focus to more of an expanded ecosystem awareness focus, get people engaged behaviorally in our world, which I believe is so desperately in need of awakened presence and compassion and, all of that, those good things. So we are going to expand into some online course offerings fairly shortly. People have asked about like whether or not there's a VR application for this. And I'm like, maybe. I don't know much about that, to be perfectly honest. I think for us, like if we can figure out some of these economic, systematic components of how is it reimbursed under what, right? Like we could figure that out. It would be really wonderful to expand either regionally or in a particular set of key cities. We would love to do that. It's just one day at a time.
Oh, absolutely. Bits and pieces at a time. And the VR idea is quite interesting because I could definitely see that, because if you've never experienced virtual reality, even something just so simple as my nephew had it on his phone and it, attached to your head in this thing. And I was on a roller coaster and you could not have told me that I was not on a roller coaster. They took videos of me and everything. And I really felt like, I knew I wasn't, but I still felt like that I was on a roller coaster. So I really could see I could really see that as an expansion. That's interesting to me. I have to keep watching you and see where things go.
Yeah, we'll see. It's like really cool. The opportunities will present themselves in the right timing.
That they will.
And I have a lot of faith. So
keep at it. So speaking of that, on the opposite side of that, what do you think are some of the biggest misconceptions about alternative healing practices, like the ones that you offer at Quantum Clinic? I know a lot of people are like, this can't be real. You can't be, you aren't getting the results. So what do you think about them?
That's a deep question. It's a deep question. Again, I think, it's important to meet people where they're at, right? And to be able to speak to different clients using different language, depending on their level of awareness and insight into the issues that they're dealing with, right? Yeah. People who are close-minded to experiences like this, just maybe they're not our ideal clients, right? And I don't need to waste my time or energy trying to sell them something that they don't think they need, right? Yeah. The experience speaks for itself. We have, have worked with thousands of clients in the 2 years that we've been opened. And the results do speak for themselves. People come in feeling one way and leave feeling relaxed, right? And that
That's
in and of
amazing.
itself
That's
is
amazing.
enough, right?
Yeah.
That's
Yeah.
enough in our world. So yeah, we just trust that to speak for itself. And the haters are gonna hate.
I think we will. I think we will. That they will. So,
Yeah.
if there is one key takeaway that you'd like our listeners to remember about coherence and healing, what would it be?
Just remember to practice self-compassion and empathy because we're all on this journey of life together. There's really no going anywhere. So how can we show up with greater capacity for resilience, for care, and for connection?
Nice. Thank you. So, where can listeners learn more about Quantum Clinic, your services, and how to get involved?
Yeah, you can definitely check out quantumclinic.com.
Mhm.
That would be a really great place to go. We're also on all the socials and YouTube, usually at Quantum Clinic USA. And if you're interested to follow my thought leadership, I'm on Medium at Dr. Katelyn Lehman, on Instagram at Dr. Katelyn Lehman, and all that good stuff.
Nice, nice. Well, Caitlin, I have really appreciated you speaking with us today. Thank you so much for coming.
It's been my pleasure. Thank you so much for having me.
Absolutely. And thank you to our listeners for taking the time to join us. We love your help. Please leave a review and share the podcast with a friend. By spreading the word, you help us grow and reach more people, allowing others to discover the valuable insights shared in each episode. Thank you for being such an important part of the Behavioral Health Today community. As always, the resources for this episode and an archive of all of our other episodes can be found on our webpage at triadhq.com/BHT. And we look forward to having you back with us next time on Behavioral Health Today.
We appreciate all the support from our community, and if you like our show, one of the best ways you can support it is by giving us a 5-star rating and leaving a review. Behavioral Health Today is a podcast part of the Triad Behavioral Health Network, all rights reserved.